Welcome to this brief guide for using the BeeBot, the Bridges Brief Observation Tool. This short module is meant for all clinical preceptors who supervise UCSF medical students during their clinical rotations. The BeeBot is a tool for the UCSF School of Medicine Bridges curriculum to guide brief observations and document feedback about a student's performance in the student records, also known as the student dashboard. The BeeBot form can be completed in real time while the faculty or resident is sharing feedback with the student. Why did we create the BeeBot? Traditionally, many supervisors have viewed assessment of students' learning as something to do at the end of the time working together. Often days or weeks after working with a student, a faculty or resident may sit down to the computer to complete an evaluation of the student's performance. This approach makes it hard to remember the student's performance in detail and delays feedback to the student about how they did. In the Foundations 2 of the Bridges curriculum, there's a new approach. Faculty and residents are asked to observe their students performing clinical skills, discuss in-person feedback, and document the feedback using the Brief Bridges Observations tool. The entire process can be completed in 5 minutes, and this module explains how. There are 3 steps to the BeeBot process. As a first step, observe the student doing a history or physical exam with a patient, delivering an oral presentation, or another skill relevant to the clerkship, or review the student's written note. The second step consists of generating 1 to 3 feedback points, ideally something reinforcing and something the student should do differently next time. Discuss the feedback with the student. The third and last step is documenting the feedback in a BeeBot form on Qualtrics survey. Documenting feedback in the BeeBot can be done while you are discussing it with the student. Here are 2 examples. The first example pertains to the outpatient clinic setting. The preceptor observed the student with a patient doing part of an H&P. After the encounter, the preceptor documents the feedback while discussing it with the student. The second example involves inpatient rounds. The attending listens to the student presenting a patient on work rounds with the team. The attending completes the BeeBot while listening to the oral presentation, then shares the feedback and discussion with the student right after rounds. This was just a quick guide about using the BeeBot. If you want to learn more, there are a lot of other resources that you can access via UCSF's Center for Faculty Educators website. On this website, you'll also find schedules for workshops on feedback, evaluations, and many other topics relevant to your everyday teaching interactions. In addition, links to further resources, including videos, tip sheets, and guidelines, can be accessed via the Faculty Development section on the CFE website. Thank you for watching this module and for all you do for our students.